What is going on, IF Warriors? Is your boy Edward V, and today we're going to talk about how a lot of people are reversing type 2 diabetes using intermittent fasting. All right, disclaimer, I am not a doctor at all, and you should always consult a doctor before starting any regimen. But if you do want to get information directly from a doctor talking about this specific topic and how intermittent fasting helps reverse type 2 diabetes, you can go ahead and click on the card right here, and that will take you to a 30-minute video that is run by Dr. Jason Fung, one of my favorite doctors and advocates for intermittent fasting, and he'll explain it in further detail for you. But I'm gonna give you the heart of why intermittent fasting assists in reversing type 2 diabetes and changing the lives of a lot of people, and it has done that as well. On that card video thing that you're gonna click, because I know you are, it's gonna explain, it's going to show people that actually went through the process and how they came out on the other side. Now, I'm going to go ahead and explain that. The thing that the medical industry, and why this is why I say that intermittent fasting was the sleeping giant that it's been for so many years, because the medical industry always wants to neglect fasting, because fasting, they always try to stigmatize, they always try to give a stigma to fasting. They always try to say, this is not the way, do this, take that. The human body itself is very, very resourceful and very, very powerful. It has the ability to heal itself. You don't really need to put outside sources if you let your body do its thing. If you put outside sources, you start messing with the balance of your body, and then that is what can cause a lot of the damage that you see a lot of people have. The thing about the medical industry, the way they treat type 2 diabetes, is that they treat it in a very quick fix kind of way. So basically, and this is explained by Dr. Jason Fung very well, is that they see that you have a high insulin, and they understand that with the high insulin you have the high sugars, and instead of attacking the high insulin that's causing the high sugar, what they do is they attack the sugar. So they'll lower your sugar, and then you will feel better for the moment, but they never heal the actual source. One perfect example that he said is that if you have like an infection on your leg, right? If you have an infection, the infection can cause multiple things to happen. The infection can give you a fever. But if this is the equivalent of you having an infection on your leg, you having a fever because of the infection, you go to a doctor, you say, hey, look, I have an infection on my leg, it's giving me this fever, and then the doctor's saying, okay, I'm gonna treat that infection by giving you these pills or this medicine that's gonna heal your fever. Now, that medicine is going to heal the fever, but it's not gonna do anything for the infection. So what the doctor should have done is he should have healed the infection with antibiotics or whatever you need for an infection, and then that in turn would have healed the person completely and eliminate the fever, eliminate the infection, and he targeted the source. So basically, targeting the source for type 2 diabetes is the insulin resistance. So how type 2 diabetes works is, think of this as the amount of sugar that your body allows you to have. When you have type 2 diabetes, you have reached this max. And the only reason that you keep pushing through is because your insulin resistance is pushing in more and more sugar above your max, and it is spilling all into your blood cells and into everything else. That is when you're diagnosed with type 2 diabetes. So what you have to do is you have to reduce the insulin so that it can no longer push through. So then that way the sugars that you do have in your cap starts to reduce. Because it's like think of a cup. If you pour water into a cup and it's at the max, that's, you know, it's over. But how does that water go down little by little, little by little? It will never go down, as every time you put more water on top of that water, it keeps on spilling over. So you want to get that gone completely. The only way to do that is to attack the insulin. If you do like a ketogenic diet and you remove carbs, which has the sugars and stuff like that, it's gonna help. It isn't going to help it all the way, because protein and carbs still can increase insulin as well. It doesn't fully decrease the insulin, and it doesn't do it very quickly. It sort of does it, because you're removing the sugars. You are removing the sugars, but you're not really attacking the insulin resistance when you do a ketogenic diet. That's why I say, if you're going to do the ketogenic diet, you should also do intermittent fasting, because when you fast, you are removing protein, fats, carbs, everything, all those things that can cause insulin to rise. And then your insulin will drop, your sugars will drop first, it will burn, and then your insulin will drop, and then from there your body will run on the body fat, and also the sugars have been depleted, and that allows your body to start reducing the amount of sugar that you have in your cap. And doctors even recommend insulin for type 2 diabetes. That's insane and crazy. This is why I say, like, just because, you know, the medical industry doesn't as a whole collectively say fasting is good, doesn't mean that they are right, because they are wrong on so many different issues, and this is definitely one of them. They give you insulin to treat type 2 diabetes, but not to cure it. And the reason it doesn't cure it is because the obvious. They're giving you more insulin with the insulin you already have that you don't want. If someone's a drug addict, they need to take drugs. And when you put them like on rehab to get them off drugs, that moment, that first time frame, that first, you know, month or so, they're like struggling, and every time they don't have it, they feel like horrible. They're jittery, they're moving, they're sweating, they're like shaking, convulsing. If you give them drugs, it will help, it will make them feel better. But that is just a short time frame. That is just like a quick fix that'll make them feel better for the time being, but the overall dangers of the fact that they continue to use drugs is going to affect them. So the best thing to do is to wean them off completely. Don't give them any drugs. Even though they're gonna feel weird, they're gonna feel better in the long run, and they will get used to it. And if you wanna go ahead and get more information, I will also put the video up here right at the end so that you can go ahead and click it. I'll have my subscribe button right here and the video on this side. And I just wanna say thank you to everybody about the shirts. They were very, very successful. We were able to sell a good amount. The Intermittent Fasting Glory shirt was the best selling shirt. And I don't know when we're gonna do another one, but as soon as I get all of those photos with the questions, I will start preparing the video that I promised you guys. And I hope this video has helped you. If you were looking for anything when it comes to type 2 diabetes, if you're trying to understand what it is, if you're trying to attack it naturally, the best way to do it is intermittent fasting, because intermittent fasting quickly reduces your insulin by quickly depleting your sugar and then going right to your insulin. And then that is the core problem when it comes to type 2 diabetes. Type 1 diabetes is the opposite. Type 1 diabetes is that you don't have enough insulin. Type 2 diabetes is that you have too much insulin. So if you have type 1, intermittent fasting really isn't that beneficial. But if you have, it actually might be a little bit detrimental, but if you have type 2 diabetes, intermittent fasting is key. And Dr. Jason Fung explains it very well. I have the video up so you can go ahead and look at that. I just gave you the synopsis, the quick version of what he explains, so that way you can get it right away and you understand. So have a good one, guys, and I will see you next week. Peace out.